Knowing how to manage hyperbaric therapy side effects is an absolute key to safe, effective, and comfortable hyperbaric experience. I've seen many side effects over the decade of working with hyperbaric therapy, and in this video, I'll share with you what I've seen and I'll explain how to prevent those side effects and how to manage them. The safest way to avoid side effects in a hyperbaric chamber is to make sure a person who cannot go in a hyperbaric chamber doesn't go there. That means to screen for contraindications. There are three absolute contraindications: untreated pneumothorax, acute bronchospasm, and inability to equalize ear pressure. These people should not go into a hyperbaric chamber. There's also a list of relative contraindications. Certain medications, COPD in the late stages, acute spherocytosis, pregnancy, go through the list of relative contraindications. If you have one of the conditions, consult a hyperbaric practitioner before your first session to make sure that you can start hyperbaric treatments. Screening for contraindications is essential. Your safety always comes first. Now let's look at common side effects that can happen in a hyperbaric chamber. The most common side effect people experience is ear pain or ear barotrauma. It happens because of the change in pressure inside a hyperbaric chamber, like you feel on the airplane. If you're congested or if you don't equalize pressure in your ears with an pressure inside the chamber, it can lead to ear pain and even trauma to middle or inner ear. To avoid this, practice ear equalization techniques before you enter the chamber. Make sure you can equalize pressure in your ears. I have a great video that shows you step-by-step ear equalization techniques you can use in a hyperbaric chamber to avoid ear pressure, ear pain, and ear barotrauma. Normally, we practice ear equalization on pressurization when pressure goes up, but in some cases, when ear pressure doesn't equalize by itself on depressurization, we have to equalize that pressure as well. This side effect is commonly avoidable, yet it's very common because people don't utilize ear equalization techniques. While many people feel energized after a hyperbaric session, some report that they feel tired and they have fatigue after hyperbarics. While it's common to feel tired after the first few hyperbaric sessions, normally if this fatigue is persistent or if it's severe, it means that the mitochondria is not optimized to receive increased amount of oxygen. And I have a great video that talks about fatigue, feeling tired after hyperbarics, what to do about it, what are the underlying causes, because that's important, and how to fix it. Normally, this fatigue could have been prevented, and the way to do it is to assess the current health situation of a person to see if they're actually able to receive increased amount of oxygen, to receive the increased amount of oxidative stress that hyperbaric brings with them. And with proper adjustments, the protocols have to be designed in a way that they don't overwhelm the mitochondria. If you're enjoying this content and want to dive deeper into hyperbaric, I invite you to join my HBOT certification course. It's the main program where I share everything that I know about hyperbaric therapy, how it works, how to increase its effectiveness, how to avoid common mistakes, how to deal with contraindications and side effects and all things like that. If you're interested, click the link in the video description and it will take you to the course waitlist. It's free and there's no commitment. You sign up for the waitlist and you'll receive information about the course and you will be able to join the course at the lowest possible price. We'll also send you some information and materials to get you prepared for the course, and you'll receive my free guide, 5 steps how to increase effectiveness of your hyperbaric sessions. HBOT course is great for clinic practitioners and for people who use hyperbaric therapy at home. If you're interested, the link is in the video description. Click it and I'll see you inside. Now let's go back to our video. So if you experience fatigue, tiredness as a side effect of a hyperbaric session that doesn't go away, it's time to go and see your hyperbaric practitioner and see how they can adjust your hyperbaric protocol, or maybe they can suggest some supplements that will go with your hyperbaric session that will help you get through this transitional phase. Oxygen is healing and it stimulates repair. Too much oxygen reaching the cells might not only overwhelm mitochondria, it can lead to oxygen toxicity. This is when oxygen becomes toxic, and it becomes toxic to two tissues in the body: central nervous system tissues, the brain, and pulmonary tissue, the lungs. Oxygen toxicity is rare, but it can happen when the safety limits are ignored. Trained hyperbaric practitioners know that there are human tolerance limits to oxygen. Those need to be respected at all times. There are signs and symptoms that show us that the person might be developing oxygen toxicity. And in central nervous system oxygen toxicity, for example, those symptoms are nausea, dizziness, muscle twitching, and seizures. Of course, we don't want a person to get to a seizure, and we need to avoid oxygen toxicity as much as possible. For that, we need to know when it happens. Normally, central nervous system oxygen toxicity happens at partial pressure of oxygen of 1.6 and higher. So this is when we have to be more careful with our patients. Trained hyperbaric practitioners know how to design protocols that help avoid oxygen toxicity, what symptoms to watch for, and what to do when a person developed oxygen toxicity and a seizure per se. What are the protocols to help that patient? I encourage you, never self-experiment. If you really want to learn how to develop safe and effective protocols, learn hyperbaric therapy, take hyperbaric certification course. Did you know that hyperbaric therapy can temporarily change your vision? Nearsightedness, myopia, can occur in long hyperbaric protocols. It's an adaptive change of your eye. And eventually, in long protocols, 40 sessions or more, the eye will start adapting and the vision will decline. This is absolutely temporary, and your vision will go back to your baseline within a couple of weeks after you stop hyperbaric session. There's nothing you can do to prevent this. Just be aware that there is a change like that can happen. It's temporary, it will go away. I recommend, if you plan on doing long hyperbaric protocols, get an eye exam before you start so you know your baseline, and remember that the change is absolutely temporary. Another side effect of hyperbaric therapy that you might not necessarily heal right inside a hyperbaric chamber, but that will have effect on your quality of life, is that HBOT is believed to speed up cataract maturation. We do not think that hyperbaric therapy causes the development of new cataracts. However, if the cataract is there, exposing your eye to oxygen will speed up the maturation of that cataract. There's steps that you can take to sort of slow down that process. And that's how you deliver oxygen. If you use hoods, if you use oxygen pressurized chambers or the masks, there's higher probability that oxygen either escapes from the mask or comes into direct contact with the eye. And because eye doesn't have antioxidant defenses, it causes oxidative stress, and that will speed up cataract maturation. So I recommend for people who are concerned to use nasal cannulas, because these allow less oxygen to be spilled and more oxygen to go directly into your nose. I have a client who've been scheduled to do a cataract surgery. At the same time, she's contacted a hyperbaric practitioner, who was me, to develop a protocol for the other issues of health that she had. And because of this big cataract in one of her eyes, and she was scheduled to do the surgery in 5 weeks, we decided to go with hyperbaric protocol without supplemental oxygen to make sure that there's no extra oxygen going into the contact with her eye, yet she still was able to receive benefits of hyperbaric therapy through pressure. Another side effect that you can actually feel inside the hyperbaric chamber is hypoglycemia, a drop in blood sugar. Hyperbaric therapy stimulates insulin sensitivity. It makes our cells more sensitive to sugar to glucose, so it uptakes glucose from the bloodstream to use it in an energy production cycle. And we want that because we want to speed up our metabolism. This results in the drop of blood sugar. And if you're a normal person and you don't suffer from diabetes and you can regulate your blood sugar, you will probably not even feel it. However, for people with diabetes, especially insulin dependent, but people who have difficulty regulating their blood sugar, or for those who are doing hyperbaric therapy in a fasted state because they want to combine the benefits of hyperbarics and fasting, but they're not adapted to fasting yet, this can result in too much drop of a sugar, and they will feel it as a headache, feeling fatigued, tired, irritated, and maybe they will feel like that for the rest of the day. Those who've experienced low blood sugar know exactly the symptoms that I talk about. Sometimes we call them hangry because you're hungry and angry at the same time. This unpleasant side effect can absolutely be prevented. If a person is diabetic or insulin dependent diabetic, they can take a small snack with them inside a hyperbaric chamber. If they notice that the blood sugar is dropping, they should take that. They can measure their blood glucose before going into hyperbaric chamber to make sure that it's not low to start with. Now, for people who have difficulty of regulating their blood sugar, they can eat an hour and a half before going into the chamber to make sure that when they're inside the chamber, their blood sugar levels are stable. And for those who are fasting and want to maximize the effects of hyperbarics, with fasting, doing it at the same time, but they're not metabolically flexible yet, I recommend that they take a teaspoon or a tablespoon of coconut oil before going into hyperbaric chamber. This should not break your fast because it's pure fat, yet you will not feel that blood sugar drop and you will not feel these unpleasant side effects. If you'd like to dive deeper and learn more, join the HBOT certification course waitlist. The link is in the video description. Get the free guide on how to increase effectiveness of hyperbaric sessions and plenty of additional material that will help you navigate hyperbaric oxygen therapy, how to use it safely and effectively.